Hello, I'm from Smile team. I'm oral and maxillofacial surgeon. My name is Tolgahan. What is the maxillary sinus? We are starting about the maxillary sinus. The maxillary sinus is the simple air gap. It's inside the maxillary bone structure, and sometimes this maxillary sinus is expanding or sometimes still stay same position. We are doing sometimes sinus lifting. We are need sinus lifting when we need the sinus lifting. If we planning to place the implants for the maxillary posterior bone structure, in this time we are needing sinus lifting operation. What is the sinus lifting operation? Sinus lifting operation is lift the membrane too high for the implant placement. It's a procedure, and we are using some instrument for the sinus lifting, and we have two techniques for this sinus lifting. What is this? This is one of them is the internal sinus lifting, and the other one external sinus lifting. I want to start firstly the short one. This is the internal sinus lifting. If we have 4-5 millimeters bone measure, in this time we can use the internal sinus lifting. What is this? We are using this internal sinus lifting the same time with the implant placement. If we have the 4 millimeters bone, we can carry to the patient's bone too high with some osteotome. It's a special name. With this osteotome, we can carry too high the patient's own bone. In this time, we don't need any extra bone graft. We are placing with this technique the implants place. If we don't have this 4 or 5 millimeters bone measure, in this time we are using the external sinus lifting operation. It's for the fill inside the sinus with the bone graft. How is doing this operation? After the local anesthetic injection, we are open the patient's gum. We directly see the bone structure, and then we are opening some windows. For the external sinus lifting, after the open the gum, we are using some special instrument for the open the windows. After the open the windows, we are lifting the membrane, because inside the sinus we have membrane. Its name is Schneidering membrane, but it's not important. We must lift this membrane too high for the implant placement, because we have just 2, maybe 1, maybe 3 millimeters bone. In these millimeters, not enough for the implant placement, because we are using minimum 6-8 millimeters implants measure. We lifted the membrane too high, and then we have a gap. It's just a gap. We put something for the implant placement in that area, because we can't place the implants into air gap. Because of this, we are putting some bone graft inside the sinus cavity and place the implants. When we can place implants with the sinus lifting or not? How can we decide this? If we have minimum 3-4 millimeters bone, in this time we can place the same time bone graft, sinus lifting and implant placement. Because if we place the implant, we need 3 or 4 millimeters bone structure. Why I'm saying this? Because implants must have some stability. After the place the implant, we must fix these implants moving. If implants move inside the sinus, we can lose the implants, we can lose the bone graft, it can be fail. Because of this, we want some bone structure, the patient's own structure. This is the most important things for the same time implants and the sinus lifting. Open the sinus lifting, place the implants, place the bone graft, and close again the gum. After sinus lifting operation, we must wait minimum 6 months, because we put some bone graft inside the sinus, and the patient's body will grow up this bone graft, and it change with patient's bone. The bone graft will change to oven bone. Because of this, we need minimum 6 months. Why 6 months? I don't know. But this bone graft material is changing in 6 months, and we can't change this procedure. Sometimes it can change. It can be 7 months or 8 months, and we are deciding after the operation, and we are informing the patients after the operation. But we need minimum 6 months. That's the important things. After the sinus lifting, the patient has some swelling. That's normal because this is the body reaction. Because we are putting some bone graft inside the sinus, and we are covering some special material. Its name is membrane. It's a synthetic material. We are using from outside and putting over this bone graft. It's for the separate from bone graft to gum tissue. We must separate these two different tissue, and we are closing this bone graft with the membrane. We are using some stitches for close the gum. After this all procedure, we are waiting some swelling. That's normal because the body is giving some answer for this bone graft and this procedure, and we can't change. Maybe patients has some bleeding. That's normal, and of course the patients will have some pain. That's normal because we are doing surgery. But after the operation, I'm giving some medicine with the prescription. What is this medicine? This is one of them is antibiotic, and the other one painkiller tablets, and mouthwash and antihistaminic tablets. All of them is for the sinus healthy because we must prevent from infection this bone graft, and we must stop the patient's pain, and we keep clean the mouth. This is the most important things after the sinus lifting operation. Yeah, complications. The most important complications is if the patient's gum will open, we can have some fail about the bone graft because the bone graft must not touch the normal tissue, gum tissue or saliva or inside the mouth, anything. It must not touch the other things. We must separate this bone graft from everything. If the patient's gum open in that area, we can fail. We can lose the bone graft. The patient has some bleeding, that's normal. We can lose the implants. This is the most important complications after the sinus lifting operation. If you have any question, you can text below this video. It's time to smile again.